We also want to continue to emphasize that vaccination is the best way to prevent the spread of this virus and to prevent the severe complications.
Welcome back. That was some of what we heard from local officials in West Texas fighting to contain, they hope, a growing measles outbreak. Our Omar Villafranca is in Lubbock with more.
The press conference is just wrapping up here in Lubbock, and health officials here at Covenant were able to confirm that a school-aged child who was being treated here did die in the last 24 hours from complications from measles. This is the first measles-related death in this outbreak. They also went on to clarify some other information, that the hospitalizations that they do have here, everyone who is hospitalized and getting treatment is not vaccinated. Now, just for some background, this outbreak started in Gaines County, about an hour and a half away, in an unvaccinated Mennonite community, but that community does interact with the general public, and that's why we're starting to see this spread into other counties. Now, health officials here are saying the best way for people to prevent the spread of this is to get their measles vaccine. They're saying measles is very contagious. If I had the measles and you were across from me and you were not vaccinated or didn't have any immunity, 9 out of 10 times you would get sick with the measles. So they're continuing to monitor this. They are working not only with the city of Lubbock and also in the community here in West Texas, but are also working with the state, and they're in contact with the federal government. Side note, we heard that HHS Secretary RFK Jr. Was at the White House talking today about some facts. He mentioned 2 deaths. When we asked the health officials here, they are only able to confirm 1 death. He also mentioned that the hospitalizations were for quarantine. The doctors here clarified the patients who are here at the hospital, they are not in quarantine. They are actively receiving treatment, especially since it's a respiratory disease, for breathing, extra oxygen, things like that, helping them breathe. So we're going to continue to monitor this, and when we get more information, we'll let you know. Back to you.
Omar Villafranca, thank you very much. We're joined now by CBS News Chief Medical Correspondent Dr. Jon LaPook. Dr. LaPook, always great to have you at moments like this. We don't want to alarm the public. We want to inform. What are the most important things to know and contextualize about what we're seeing playing out in West Texas?
Well, first of all, it is so sad, Major. I mean, a death from a vaccine-preventable illness is especially sad. I have to say it's not particularly surprising to sort of put this in perspective. The measles vaccine was licensed in 1963. Before that, every year there were about 500,000 reported cases, probably 3 to 4 million cases in all. So many went unreported. And there were about 50,000, 48,000 hospitalizations. 1,000 people got encephalitis, which is brain swelling, brain inflammation, and about 400 or 500 people died. What happened after the vaccine came along, it just plummeted. You don't see that ever. It's just the most dramatic thing on the graph. It just goes down to the point where it was eventually considered to be eliminated. And to see it creeping back now, and especially in these pockets of parts of the country which are not especially immunized. You need 95% of the population immunized because it's so infectious, so contagious. You need about 95% immunized to get herd immunity. And that's dropped now to about 93% of the country being immunized. I think it's 92.7 as opposed to it used to be a couple of points higher. So it is slipping down, and especially in these little pockets where a lot more than that are not getting vaccinated, people are very vulnerable.
And Dr. LaPook, of course, Robert F. Kennedy Jr. as head of HHS, what he says matters. It's scrutinized perhaps more intensely than a previous HHS secretary. He also said, in addition to the things that Omar Villafranca clarified, that measles outbreaks in our country are, quote, not unusual. Is that true?
It is true. There are pockets of these people who get infected every year, or often, intermittently. In places, we saw it in a Hasidic community. We saw it in other populations where they weren't getting vaccinated, and it was way less than 90%. It could be 50% or something like that. So you do see these pockets. The problem is that as you're seeing vaccine hesitancy increase and vaccine uptake sort of slip down, the voices from the people who are in power matter. And even if they're not saying not to get vaccinated, saying nothing in a situation like this is actually saying something, right? So people need to understand that this is a highly contagious illness. It's actually much more contagious than the flu or COVID. And to put it in perspective, there is a double whammy here because not only is it highly infectious, but it has a long incubation period. And Major, what that means is with an incubation period of 10 to 14 days, somebody can be infected, not know it, travel around and infect other people because they can be infectious 4 days before they even get a rash. So they're infecting other people. On top of that, it's so infectious that somebody who's infected could leave a room and then that virus can linger in the air for a couple of hours, and somebody who's then vulnerable can become infected just 2 hours later, go into a part where the person has left a couple of hours before then. So, there may be people out there who think, and I understand this thinking, and I've heard it from people when you talk to people and say, there are risks of not taking it, not just to you, but to other people. And they say, look, I'm rolling the dice for myself or for my kid, and so that's my decision, and I understand that. But they should keep in mind, we looked at the numbers, and there are about 17 million immunocompromised adults and 2 million immunocompromised kids. And so you're not only rolling the dice for yourself, you're rolling the dice for them because they're relying on other people getting immunized for the herd immunity so that they're protected.
Dr. Jon LaPook, thank you very much, sir. I appreciate it.